happens is becomes a risk factor for development of fibrosis, and as the fibrosis progresses, person can land up into cirrhosis and hepatocellular carcinoma. And it usually requires a liver biopsy for the diagnosis. But as we know, liver biopsy is invasive. As data from Dr. Ajit says, we have a huge burden of fatty liver disease. So we definitely need non-invasive markers like fibroscan for evaluation. So you must have heard of one of iceberg phenomenon. So NAFLD is an iceberg disease. So what you are seeing only is the liver manifestation. So what previous speakers have been able to focus on is that it's not only a disease of liver, it's a multi-system disease. So they may be associated with lipidemia, hypertension, hyperinsulinemia, insulin resistance, and obesity. So what are components of metabolic syndrome? Base circumference more than 100 centimeters in males, more than 88 centimeters in females. But this is West. Indians, more than 90 centimeters in males, more than 80 centimeters in females. Triglycerides more than 150, HDL less than 40 in men and less than 50 in females, and blood pressure more than 130 systolic and more than 85 diastolic. If any person has three of these criteria, then you can label this person suffering from metabolic syndrome. Or fasting plasma glucose more than 100. Now, what has happened is that, there is some discussion going on in world community to stop using these negative connotations like non-communicable disease. So people say disease of lifestyle. So that's why a group of experts said and discussed this question that we need to bring in a negative connotation. So why bring alcohol? Why bring non? It's a disease of metabolism. So the new term is metabolic associated fatty liver disease. Now, I'd like to draw your attention to this slide. If a person has hepatic steatosis, which has been diagnosed by any imaging, blood markers, or by histology, he goes directly into metabolic dysfunction associated fatty liver disease. If he is overweight, there is obesity, more than 25 kilogram, but in Asians we call it as more than 23 kilogram per meter square. If steatosis, type 2 diabetes goes directly into MAFLD. So these two, steatosis, obesity, MAFLD. Hepatic steatosis, diabetes, MAFLD. There is something called as lean MAFLD. Lean individuals whose BMI is less than 23, they still have hepatic steatosis, and you need to have these, at least two of these metabolic risk factors. That includes base circumference, blood pressure, these are part of metabolic syndrome. And then two new things have been brought in, like Dr. Dela said, there is an inflammation. So is there a role of C-reactive protein? And then this is a measure of insulin resistance. So this has been a frame shift change in the thinking towards making MAFLD a positive diagnosis, and diagnostic criteria have been given for the first time to bring in the diagnosis of fatty liver disease. Now what we need to understand is that India is going through a double whammy. We already had a huge burden of so-called communicable disease. And on top of that, this obesity, hypertension, and diabetes epidemic is creating an additional burden of non-communicable diseases in India. So we have a huge burden of communicable diseases like tuberculosis, hepatitis, malaria, HIV. And on top of that, now we have non-communicable diseases which are actually contributing more towards mortality. If I recall last report by, ICMR, it said 55% of deaths in India are now because of non-communicable diseases. And this conundrum of all these three is a perfect recipe for an NFL epidemic in India. So, what is the data of diabetes? So there was this study in ICMR conducted study, and they found prevalence ranging from 5% to 13% in different parts of India. So estimated number by 2011 was 62.4 million. So करीब 6.5 करोड़ लोगों को डायबिटीज थी, 72 करोड़ 7.2 करोड़ लोगों को 2017 में एक्सपेक्टेड थी, and by 2030 around 8 crore people will be diabetics, and approximately 50% of diabetics have nephrotic. So we have a huge burden of diabetes, and on top of that you have a huge burden of hypertension. So different studies which have been conducted in both the rural and urban population, around 1/3 of Indian population is hypertensive, more in males, less in females. This was a cures study which was conducted in Chennai urban area, which reported 23% in males, 17% in females. And hypertension is responsible for 57% of strokes and 24% of CAD mortality in India. So 1/3 of Indian population is hypertensive. 9 crore people with diabetes. Now, ये त्रासदी है कि a country where 270 million people live below the poverty line, obesity seems to be a distant issue. But what data says? Now, this was a Lancet study which was collecting data on overweight and obesity in children and adults. So, US is the most obese country in the world. However, China and India together contributing to 15% of world obesity, with 46 million and 30 million obese people respectively. Now, this is 7-8 years old data. So, National Family Health Survey 15-16, 1/5 of Indian women, 20.7% in the age group of 15 to 49 were overweight. Almost 1/3 of urban women were obese, and 15% of rural women were overweight. 18.6% of males are obese, and it has increased, it has actually doubled in a decade. So this epidemic of obesity is actually a very, very frightening way of increasing in India. Then, what about insulin resistance? So, Asians are considered to be insulin resistant, and it has ranged, different studies have ranged from 7% to 55%. So the data shows there is a huge burden of obesity, a huge burden of hypertension, a huge burden of diabetes, and a huge burden of insulin resistance. So, what we need to understand is that urbanization, sedentary lifestyle, fat-rich diet, and genetic predisposition for diabetes makes us an ideal candidate for metabolic syndrome, reservist insulin resistance, and as Dr. Ajit said, nephrotic is a manifestation of, practic manifestation of nephrotic. So this all contributes to development of nephrotic and NASH in Indians. So this is, Indian National Association of Study of Liver came out with its guidelines for non-alcoholic fatty liver disease 3-4 years back. So what was their, they say, on the basis of studies conducted in different parts of India, prevalence of NAFLD varies from 9 to 35% in India. So if we take a rough estimate of prevalence of 20%, so we have a huge 24 crore people will be fatty liver, will be having fatty liver in India, and that is huge. And a small part of those goes on to develop cirrhosis. As a gastroenterologist or as a hepatologist, I can imagine in 2040s and 2050s, our major burden of liver disease will be NAFLD related. Majority of these patients would have gone on to develop cirrhosis and its health complications. So possibly in 2040s, 50s, in India, the most common indication for liver transplant will be non-alcoholic fatty liver disease and its associated complications. So एक पेशेंट है गैस्ट्रोपीडी में आता है, एक एलएफटी की रिपोर्ट लेके उसके एंजाइम्स पड़े हुए, तो जो डाटा कहता है कि NASH एंड chronic viral hepatitis are the two most common causes of asymptomatic rising hepatic transaminases. And NAFLD at present is the third most common cause of CID. Most common is ALD, alcoholic. Then you have chronic viral hepatitis. And third most common currently is NAFLD. We had analyzed our data, and our data was actually the same. We had analyzed of our admissions of around 1,000 patients, and we found that around 45% of our admissions were because of alcoholic liver disease, and 40% were because of viral hepatitis. अब एक और चीज है, normal LFT doesn't mean that the patient doesn't have severe liver injury. ये स्टडी हुई थी मुंबई से, इसमें एक 1/4 of the patients with normal liver function test had evidence of cirrhosis on liver biopsy. So a normal LFT doesn't rule out cirrhosis. अब एक पेशेंट है जिसको cirrhosis है, there is no history of alcohol and viral markers are negative, all other workup for chronic liver disease is negative. Initially these were labeled as cryptogenic cirrhosis. It was a study which was conducted from PGH and Chandigarh. उन्होंने markers of metabolic syndrome, diabetes तो नहीं है, any previous history, क्योंकि cirrhosis के बाद weight loss हो जाता है. बट एक पेशेंट जो कभी 90 किलो का था, now he's 70 kgs. So highest body weight in the lifetime, abnormal lipid profile. So they found that in a substantial number of these cryptogenic cirrhotic patients, the reason was possibly non-alcoholic fatty liver disease. Similar data is with cryptogenic hepatocellular carcinoma. So all these say that earlier this condition was not recognized, it was not given its due. So a lot of these patients were labeled as cryptogenic cirrhosis or cryptogenic hepatocellular carcinoma, but possibly. And one important thing which we need to understand is that in NAFLD, HCC, hepatocellular carcinoma can develop without developing cirrhosis. The two conditions, hepatitis B and NAFLD, they can go directly into hepatocellular carcinoma. So how Indian NAFLD is different from West? Mean BMI in Indian patients with NAFLD is lower. Possibly हम लोगों का height is less in comparison to West. Possibly इसलिए हमारा BMI कम होता है. Lower prevalence of diabetes, hypertension, metabolic syndrome in patients with NAFLD. हमारी histological severity West से कम है. Okay. Now, so till now, what we have been able to discuss is what is NAFLD, what is NAFLD, a new concept of NAFLD, the burden of disease which India is currently having and is expected in the next couple of decades. Diagnostic part has already been discussed by previous speakers, where you have biomarkers, liver function tests, fibroscan, ultrasound, fibroscan. All these are, some of these things are available in each institution in our department. So currently, another key thing which we need to understand is that there is no approved pharmacotherapy for NAFLD. कोई भी दवा अभी तक conclusively proven नहीं है कि it improves NAFLD. Okay. So what is important is, like what Madam Vasanta said, that you need to bring in a huge change in your behavior. So what you need is lifestyle modifications, antioxidants, insulin sensitivities. I put in a question mark. A lot of clinical trials, but currently no drug approved. So what is important is that आप अगर वेट कम नहीं कर पा रहे, exercise करो. So your aim is, if you decrease your weight by 5%, to decrease your liver fat. If you decrease your weight by 10%, then you decrease your inflammation एंड एक्चुअली स्टेज जो फाइब्रोसिस की स्टेज होती है वो F1, F3, F4 फोर स्टेजेस में होता है। तो अगर आपने 10% वेट लॉस कर लिया है, 100 किलो से 90 किलो आ गए होगा, तो आपकी अगर फाइब्रोसिस F2 है तो एक स्टेज कम होने की संभावना है। देयर इज रिवर्सल ऑफ फाइब्रोसिस। The same thing. So a study, 52 weeks of lifestyle intervention. Just see the last column here. Percent of patients achieving weight loss. 10%. Only 10% people are able to maintain their weight loss. 10%. Getting my point? So it's easier for us to say that look, you need to reduce weight, but it's extremely difficult for people to actually lose weight, and if they lose it, to maintain it. Okay. So what is now the minimum criteria is 30 minutes exercise, at least 5 days a week, that is 150 minutes of exercise. But that exercise cannot be a walk or you're strolling in the park. That exercise makes you breathless, is recommended, minimum requirement. Okay. So diets rich in unsaturated fats, there's something called as Mediterranean diet. It has been shown to reduce liver fat even without weight loss. So what it includes is we should have more of fruits, vegetables, olive oil, beans, nuts, legumes. So जो हम लोगों का फूड है, देखिए हमारा फूड बढ़िया है, पर हमारे को जो आदत है हर चीज को तेल में तलने की, वो काम खराब कर रही है। ठीक है, ये हम लोगों की कोई चीज हम दिवाली पे जाएंगे मिठाई का डिब्बा लेके जाएंगे। ठीक है, तो ये थोड़े से हमें अपने लाइफस्टाइल चेंजेस करने पड़ेंगे। ठीक है, बर्थडे में गिफ्ट देंगे, चॉकलेट का डिब्बा देंगे, तो वो चीजें कहने को तो स्वीट है, पर वो स्वीट भी है, पर वो काम खराब कर रही है। फूड विद एडेड शुगर, दैट इज सुक्रोज, फ्रक्टोज, हाई फ्रक्टोज कॉर्न सिरप्स, जो हमारे फ्रूट जूसेस में होते हैं, हमारे कोल्ड ड्रिंक्स में होते हैं। जैसे बताया था मैडम ने, increases synthesis of triglycerides by de novo lipogenesis. Increased fructose intake is associated with dysbiosis, increases gut permeability, increases hepatic inflammatory markers, and steatosis. What about coffee? तो जब हम कॉफी की बात कर रहे हैं तो ये ब्लैक कॉफी की बात होगी, ब्लैक कॉफी की बात होगी। अगर 2 से 3 कप कॉफी आप पी रहे हैं, your risk of development of excessive goes down in patients with NAFLD. Now, what about some dietary therapy? Some people have used vitamin E. It has been shown to decrease liver function, abnormalities, increase inflammation, but not fibrosis. और किसी विटामिन का मेजर कोई रोल नहीं। So the question was asked by one of the participants about the role of omega-3 fatty acids. बेटे देखो पॉइंट क्या है कि आप कमेंट तो कुछ भी करो, but in today's world, age and world, you need to have data, and that data can only happen. There is no data to support that any of the drug therapy works in patients with non-alcoholic fatty liver disease. कहने को कि अब फूड फैशन है कि ओमेगा-3 फैटी एसिड कैप्सूल खा रहे हैं, खा लीजिए आप, possibly उससे कुछ peripheral benefits होंगे, but in terms of current seminar, Stanford, there's no data to suggest. This was like thiazolidine diones का कोई रोल था, एक parents trial हुआ था, let's see. So what is NAFLD? Fat with or without inflammation, with or without fibrosis. Why does it occur? Fat excess, insulin resistance, oxidative damage. How big the problem? It's the second leading cause of liver transplant in US. As I say, in the next couple of decades, it may be the leading cause of liver transplant in India. Who are at risk? Obese, diabetics, hypertensive, and people of Indian origin. Imaging may say you can diagnose, and current known pharmacotherapy, only lifestyle modification. So I'll finish my presentation NAFLD is fast becoming one of the top concerns for clinicians to face the diabetes epidemic and its potential to progress to advanced stages. Thank you. Are there any questions? I can.
Thank you, Dr. Rohit Gupta, sir, for expanding the knowledge regarding the NFLD. And if any of the question is there from the participant side, please, the floor is open for the discussion. Yes. So if there is no question, I thank sir again. Once again, thank you, sir, for taking this session. Now we are moving to our
I
last.
just have one submission only. Rakhi, I have to go to COVID area for my rounds, so I'll excuse myself from the webinar.
Yes, sir. Yes, sir. Sure, sir. Thank you. Thank you
Thank
so
you.
much.
Thank you for your kind invitation, and thank you for all the participants.
Actually, I just inform sir regarding your presentation. You are going to present.
Sir, today actually I am presenting my PhD topic.
Okay, yeah, please carry on, but I have been getting calls from my COVID area, so I have to speak.
Okay. Thank you so much, sir.
Okay. Thank you, sir, for giving your precious time. Now we are heading towards our last session. I'm delighted to call Dr. Rakhi Mishra, Assistant Professor, College of Nursing, AIMS, Rishikesh. Madam has more than 14 years of rich experience in the field of nursing. Madam has published many of the national and international research papers. Madam has skills in dealing with the clinical nursing, nursing ethics, and modification of lifestyle in a healthier way. Madam is currently working on the project How Lifestyle Modification Can Affect the Fatty Liver. So I'm very much delighted to call Dr. Rakhi Mishra for taking a session on role of yoga and physical activity on fatty liver disease, an evidence-based approach. I welcome you, ma'am. I welcome you, ma'am.
Thank you, Hemlata. So, role of yoga and physical activity on fatty liver disease. So, this is my PhD project, and my guides was Dr. Vasanta Kalyani, Dr. Suresh Sharma, Dr. Rohit Gupta, Dr. Bela Goyal, and Dr. Ajit Singh Bhadoria. So, I'm very glad to present my this topic, which is already approved by our institutional ethics committee in front of my co-guides and my guide. So the title of my project is Efficacy of Yoga-Based Lifestyle Modification Program versus Standard of Care on Hepatic Steatosis Indices among adults diagnosed with non-alcoholic fatty liver disease, a randomized controlled trial. The objective of my study is to assess and compare pre and post interventional hepatic steatosis indices in experiential and control group. So the need of the study. So we all know non-alcoholic